Hello, and welcome again to another episode of Cutting Edge Health. Today we're talking about OCD, also known as obsessive compulsive disorder, and why it's a way worse disease than you think it is. If we haven't met, I'm Dr. Orlando Landrum. I help patients understand pain that gives them an issue with either their mental, their mood, or their physical, and how to be able to punch it in the face and get back to leading the life you deserve. Today we're going to talk about obsessive compulsive disorder and kind of explain some of the things that are stigma, that are not true and accurate, and then how and what you can do about it if this is a potential issue for you. So let's get down to kind of the details and brass tacks of OCD. So we talk about OCD. It's traditionally an unwanted thought or irresistible action that is compelling and is difficult to deal with. So when we talk about this, in essence, it is something that is very difficult for the person to really be able to avoid. It interrupts their life. It changes what they're able to do on a daily basis and how to be able to be functional. So we're taking from one of the articles that we're going to review a little bit later. It puts up this diagram where you have this thought that comes in and it draws attention. And then there's a doubt that's associated with it. And that doubt is that, well, everything's not okay. And if everything's not okay, then there'll be bad consequences. And then anxiety develops where you have this level of anxiety that goes up even if you try to resist it. And then there's an action that results where you feel like you have to do something to make sure everything is okay. And that's kind of that circular sequence of events of what happens with OCD. We talk about it, we can see that it's fairly prominent and it's actually more common than what we would believe for it to be, that there's a risk factor that has things like genetics that play a risk into it. And there's certain things that can be able to cause different issues that make it more likely for you to have this problem. There are assessments and different tests that let you be able to kind of identify it. And we'll talk about where you might be able to go online to find some of those things. But one of those traditional tests is a test that asks a number of different questions. One, does your mind often make you do things like checking or touching things or counting things, even though you know you don't really have to? Are you particularly fussy about keeping your hands clean? Do you ever have to do things over and over a certain number of times before they seem quite right? Do you have trouble finishing your schoolwork or chores because you have to do something over and over again? Do you worry a lot if you've done something not exactly the way you like? Do these things interfere with your life, and do you try to stop them? Traditionally, when we think about OCD, we think that, oh, well, it's not that big of a deal. Basically, it's something that helps people be more effective at their life. And honestly, it really doesn't. It has them doing these redundant circles of activity when they know that they don't necessarily need to, but they feel compelled. And these thoughts kind of dominate what is going on with them. So examples are the following. So things like contamination obsessions, where you have this fear of being in contact with a contaminated substance like body fluids, germs, environmental contaminants, household chemicals, things along those lines. For you to have different issues with perfectionism, where it's concerned about evenness or exactness, or having a need to know or remember, or just doing a task perfectly. Things like responsibility and making sure that those things are addressed. Otherwise, something terrible is going to happen. or things like a violent obsession where you have a fear of acting on an impulse to harm oneself or harm others. So that and things like sexual obsessions, religious obsessions, but then there are compulsiveness of what to do about those different things, so that you have to wash your hand excessively or shower or bathe or clean household items or do things where you have to check. You have to make sure that there's nothing that harms other people or yourself or nothing terrible has happened, and repeating routine activities like going in or out of doors, body movies like tapping and touching, blinking, or acting in multiple. So all those things can occur and be incredibly disruptive. As we have looked and evaluated studies, we've been able to see that there are brain pathways that probably facilitate this being a condition that can be looked at from an electrophysiologic standpoint and an anatomical standpoint. So those are going to be things like this particular one that references different components of the brain that we've talked about before in other contexts and how they relate and go back and forth with communication. Probably a better way of identifying it is one that looks at the brain structures like this, where you can see the areas highlighted in blue that are targeted structures for different neuromodulation type treatments, whether it's invasive or non-invasive, and how these structures, as you can see, are in close proximity, and that they are causative elements to being problematic with OCD, and there are ways to be able to treat it. So we traditionally think about the assessment. We kind of covered that a little bit, but there's some interesting, unique things that you would not think are traditionally associated with OCD and might be a little unusual. So if you have a family history of autoimmune disease, if you have inflammatory events during pregnancy or miscarriages, you might have a predisposition to it. The different lab markers that you can see as we look through this that are inflammatory in nature, like interleukin 1B, cytokines or tumor necrosis factor alpha, C-reactive protein, all those things have a potential aspect of inflammation, which we see are now more and more having some inclination of having issues with problems with various different mood disorders. So one of the reviews looks at brain stimulation and is there a potential viable option, and as kind of touched on in a period, there are different ways to be able to treat it using brain stimulation. But before we get to that, let's talk a little bit about stigma of OCD. So stigma itself is a marked disgrace or a stain that's there. And many times there is a stigma that's associated with mental health problems. OCD can be seen because you're doing these activities in order to be able to, which are compulsions, that are to try to be able to deal with the obsessions that are present there. But the best way to deal with the stigma that kind of comes about, because normally that person can be seen as not as strong or that they're not as stable, is to really educate people and have them understand that there are options for that person. When we look at different ways to be able to evaluate, there's a number of different tests that can be done to see, hey, is this a potential issue? Is this a potential way to be able to kind of address it? And when we look at different types of therapies, we can see, as mentioned before, there's traditional type of therapies that can be utilized, and there's non-invasive therapies and invasive therapies. So things like TDCS, TMS as a potential option, and then things that are more invasive like DBS, vagal nerve stim, both invasive and non-invasive, and things along those lines. One of the questions is it genetic? And there's paper that looks at that, and one of the things that we can see is that it can be familial, that genetics can play a role, that there is a whole host of different genes that are involved with this, both common and rare variants, but there can be a genetic risk that's in play. So when we talk about traditional treatment before we talk about invasive and non-invasive, the two most common ways to be able to deal with OCD are going to be things that are like ERP, which stands for exposure, response, prevention therapy. So what is that? It's a type of treatment that exposes the individual to the source of obsession or fear over and over again without acting out the compulsion, as mentioned before. And by doing that repeatedly, it can force your brain to be able to identify that it's not a necessity and that it may be a bit irrational. In addition, there's also cognitive behavioral therapy, also known as CBT. And in essence, it helps patients identify, understand, and change negative thinking patterns and behaviors. The challenges is that these different treatments are not always successful. And anywhere from 40 to 60% of that in combination with medication doesn't really work. And that's why we mentioned some of the non-invasive therapies that are out there. But just because those things don't work doesn't mean that there aren't resources out there for individuals to find help. And so one of the things that we want to do is to really be able to provide connections. So there's different entities, particularly online, that can give help. Aspect of Made of Millions, they have a number of different ways to be able to reach out for those people who are needing mental health professionals and individuals to be able to provide aid. There's a number of different apps that are connected to different entities, and this one that's called One of Mine Cyber Guide, it has a whole host of different apps that can be able to allow someone to be able to avoid that stigma of traditional evaluation and treatment and provide some degree of aid. There's different resources out there like the OCDF, which can be able to help individuals and learn more about the problem that's there. There's elements like the components of OCD from the UK that evaluates and assess. And one of the ones that we really like a lot is the No OCD, which is an interesting entity that combines patients to therapists and does it by figuring out insurance that provides help and aid. So what we know in kind of summation is that OCD is not just something that is this crazy, reasonable entity. There are both genetic as well as neurophysiologic reasons for why this problem can occur, that there are different treatments to be able to utilize. There are resources for people to find more information about learning more about OCD, how to be able to deal with those thoughts that are disruptive and interfering with your life. And there are other treatments for even if that doesn't respond that can utilize non-invasive and invasive therapies to get your life back. How to be able to punch pain in the face, whether it's mental or physical, and really get back to leading the life that you deserve. If this article sparked questions, comments, or things along those lines, please leave them in the commentary. We'd love to be able to get your insight and how OCD may have affected you or someone that you care about. And if there's questions that you have specifically, whether it's nutritional or interventional or other elements of how to be able to kind of be more granular with understanding treatment options, please let us know. Thank you so much for your time and have a great day.